Just a quick review of the book, Non-Surgical Treatment Options for Knee Osteoarthritis, an informative guide for patients, written by a doctor, so that's good. Basically, the book's divided up into 9 chapters. I'm going to name each one briefly just to give you a good idea what's in the book. First one's kind of an introduction chapter. 2 are the basics of knee osteoarthritis, so that's always good to, know exactly what's going on. 3 are lifestyle changes. 4 is physical therapy and complementary therapies. 5 are injections. 6 are medication and supplements. 7 are topical creams, lotions, and ointments. 8 is braces and assistive devices. That assistive devices would be like canes and walkers. And then 9 is where to go from here. So as you can see, the book, I think the value of this book is it gives you a lot of different strategies that you can use, maybe some things you hadn't thought about to try for your knee arthritis. So I think it's a good resource for that. And glad to see there's some good books coming out now for knee osteoarthritis. Other books I like, Treat Your Own Knee Arthritis. This book's another evidence-based book by Jim Johnson, PT. I really like the approach of this book in particular. Basically, it's saying don't think of your knee as like, an automobile tire, that the tread's gone, that your cartilage is gone, and so your knee's shot. That's really not the way it works. This book brings up a lot of published studies. For instance, a lot of studies in the literature, in the arthritis literature, they take 100 people and they'll x-ray their knees and they'll find out how bad is their knee arthritis. And then they'll check and see how bad is everybody hurting? How much pain are these people having? Well, what they find is there's really a big discrepancy between how bad their knee looks like on x-ray and how bad they're hurting. In other words, they can hold up an x-ray of somebody who has like grade 3 or 4 arthritis, maybe like bone-on-bone contact, and they don't have any pain. And yet they can find people with grade 1 or 2 arthritis, with just a little bit of cartilage wear, and they're having a lot of pain. So there really isn't a big, strong correlation in the arthritis literature between x-rays and how bad you're hurting. You just can't tell. So what's the answer to the puzzle there? Well, basically it's function. If you take those same 100 people, you see how bad their knee arthritis is, and you check their function. You look at things like, okay, so how strong are all these people's knees? How flexible are these people's knees? Then you can find a correlation between who's in pain and who isn't. So basically, function is really the main thing. Stop worrying about the cartilage so much. Start worrying about your knee function. If you improve the function of your knee, pain goes away, you're able to move better. To that end, this book kind of is concentrates on function, these 4 little tune-ups for your knee. Whole program, very evidence-based, takes you less than 10 minutes a day to do. Tune-up number 1, how to make your knee much stronger, how to make your knee more flexible, how to improve your proprioception. You might not know this, but a lot of people with knee arthritis have decreased proprioception. That's your position sense. How to improve your knee endurance. Very, very good book. So if you want to improve your knee function, that's another strategy, just another way of attacking your knee arthritis problem. This book here, great book, gives you lots of options. You might come up with some things you never knew about. So yeah, definitely worth it. So check it out.